I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar. Let's talk about axillary lymph node dissections and who needs to do them. An axillary lymph node dissection is removing all of the lymph nodes under the arm like this picture is depicting. These are the lymph nodes that breast cancer typically will spread to first if it's going to spread outside the breast and into any lymph nodes. Usually, patients these days will get something called a sentinel lymph node biopsy. So the first 1 or 2 lymph nodes gets removed rather than all of them. And that's what this photo is showing. Most patients don't need to have all of their lymph nodes removed, but in the past, we were removing all of the lymph nodes on every patient because we didn't understand this concept that breast cancer will spread to the sentinel lymph nodes first and then the rest of the lymph nodes under the arm or in the axilla. But there are still some patients who do need to have all of their lymph nodes removed, which is a procedure called an axillary lymph node dissection. For those patients whose cancer has spread to multiple lymph nodes and those lymph nodes are fixed and matted under the arm, they are not eligible for a sentinel lymph node biopsy and usually do need to have all of the lymph nodes removed. Sometimes patients also have multiple lymph nodes with cancer before chemotherapy or immunotherapy or HER2 blocking treatments, and then after that they don't have a great response and their lymph nodes still look enlarged and full of cancer, and they need to have all of the lymph nodes removed. In general, the only reason these days that surgeons and medical oncologists would recommend removing all of the lymph nodes is when we're concerned that not removing all of the lymph nodes would be leaving cancer behind. The reason we try to avoid doing axillary lymph node dissections is because usually patients have a permanent hollowed look under their arm, which is asymmetric from the other side. They can be at high risk for lymphedema or permanent irreversible arm swelling, and they may even have nerve injuries or problems. Axillary lymph node dissections in general do not improve survival, so they don't help patients live longer from their breast cancer. But sometimes we still do them because we know that if we leave cancer behind in some of the lymph nodes, then that patient is going to have a recurrence and is going to be back in a year or two with a bulky cancer under their arm.